Hi guys, this is Dr. Bhupesh once again for speaking session. Please subscribe our channel if you have not. We have just done a wonderful recording session, reading session as well. We have recorded it, and please do watch that video. It would be at the end of this speaking because that is a very important reading. And please take it till the end because in the end I have told some special words which 90% will go for elimination and will help you to do difficult questions of OET. So please watch that video of reading because it's very, very important. For now, I will record this speaking session for you all. And please subscribe our channel if you have not. It's not for me, but for your own sake. But still, it's good to say, please. Maybe you will agree to me. So, okay, I'm doing this simple speaking because again, OET exam will never be difficult. It will always be an easy exam. It's just the way you perceive it. Like I'm reading this today, I'm taking both the task of patient and the nurse to make sure that you understand both the things what will happen in the exam. So in the final exam, you will get a nursing task. So you would be a nurse. You are speaking to son daughter of 82-year-old female patient who had bunion surgery 2 weeks ago. The patient will be in son daughter's care for the 6 month recovery period. That means you are talking not to the patient. These are very interesting tasks. And these tasks are little difficult because you have to talk to the family member. You're not directly talking to the patient. So when you're talking to the patient, it's easy. You need to do this thing, you need to do this thing. But now you have to talk to the son or the daughter and tell that you need to do this thing for your mother. So that is what is the difference. So first task, these are the points we need to cover. And I have always told you, if by chance you miss out on any of the single point, there is nothing to worry. But in the last, summarization or reassurance is very, very important. You can't miss out on summarization and reassurance. You can miss out one point, that's fine, but you cannot miss summarization and reassurance. So anybody who got 340 in speaking out of your friends, tell them they might not have reassured 90%. That would have been the reason. So please make sure that you are very clear in your loudness, because in OET you do not get only you do not get any kind of video, means examiner will get only your audio. So your loudness, your confidence, it is all coming from your fluency part. So in speaking, loudness and fluency are the two important pillars on which OET speaking is graded. So always be little loud and always be fluent. That these are the two important points. Please guys, even I should not say it, but I'm telling you, in speaking more important than grammar, loudness and fluency. Grammar, a little compromises is fine, but in writing, no grammar compromise, but in speaking, little bit. But loudness and fluency cannot be compromised at all. So, first point, find out how prepared the son daughter feels about their mother's discharge. So, you will simply ask, good morning, my name is Bhupesh, and now your mother has already undergone this bunion surgery. It has been 2 weeks, so now she is ready for the discharge. So, how are you feeling about it? Well, nurse, I am very happy that my mother is getting discharged, this and this thing. Okay. Explain the mother needs for the first 8 weeks. Suppose if the examiner is reluctant, examiner can be both ways. Examiner will be given this task. So, the first question is, respond to nurse question by saying you are not sure what level of care would be required. This word is given wrong. So examiner would be asking you, I don't know, nurse. I'm excited that my mother is getting discharged, but at the same time, I'm anxious that how would I take care because I'm not sure what level of care would be required. So that means first job is to ask, how are you feeling? Then you say, see, it would be it is not that difficult. You just need to follow our instructions. We will also give you a pamphlet. So first of all, let me tell you the instructions. So you will say your mother needs for the, and examiner can be completely reluctant. In that case, if examiner does not say anything, so you carry on with your task. So how are you feeling about it? Well, nurse, I'm not quite sure. Okay, don't worry. Let me tell you that it is very easy and I will give you all the instruction. First of all, I would like to tell you that your mother needs painkillers and acids, which is known as non-steroidal anti-inflammatory drugs. These are the painkillers that your mother needs for the first 8 weeks. So would you be able to give your mother the medications on time? So that is how you ask. Would you be able to give your mother medications on time? Is it okay for you? Then dressing changes are very important, and also personal hygiene is very important, and you need to prepare meals for your mother. Would that be fine? Can you do it for your mother? So these are the things you are, so that the patient can get engaged or patient's relative can get engaged. Second point, reassure the son daughter that it is manageable. Then the patient will say, oh, I don't know. Let's see what will the patient say. He will say, I'm worried you will make a mistake. You won't be able to manage physically or emotionally. So you have to tell, see, I reassure you that it is manageable and there is nothing to worry. I will like to give you advice on the strategies which will make caring for your mother much easier. First of all, you need to set up a routine. You need to get a medicine organizer, and we will organize the medicines for you. You just need to have a medicine organizer, that which medication needs to be given at which time, and also ensure that she has everything she needs nearby. And please make sure that whatever she needs, like the water bottle or something, whatever she needs during the night time, please try to be make it available around her bedside. And wear a surgical boot. And also she should be made to wear a surgical boot. So these are the only things you need to do. You need to set up a routine. You need to give medications on proper time. There can be a medicine organizer which will help your mother, or which will help you to organize medications for your mother. Then you need to ensure that whatever she needs should be nearby her. And also you need to help her for wearing or in wearing a surgical boot. Again, very simple. Then role of surgical boot protects the foot. So the patient will ask, why my mother needs a surgical boot? So you will say surgical boot is very important so as to protect the foot of your mother, as she has just undergone bunion surgery. So it is very important to wear the surgical boot to protect the feet or to protect the foot. All right. Explain that painkillers and anti-inflammatory drugs are one naproxen. This painkiller anti-inflammatory every 12 hours. Ibuprofen. So there are three different kind of painkillers. One is naproxen that should be given after every 12 hours. Ibuprofen should be given two times every 4 hourly, two tablets every 4 hourly, and you cannot exceed more than 8 a day. So this is a very simple task. Now let me tell it how to do it. So I will talk it in the sequence. Please listen to it nicely. Good morning. My name is Bupesh. I am a nurse of your mother. So I have come here to explain you everything about your mother. So may I? Well, yes, nurse, you may explain me thing, but I'm like really anxious. See, I understand that you care for your mother, but I would like to tell you your mother, Mrs. Maria, is completely fine and now she's about to get discharged. Yes, she underwent bunion surgery 2 weeks ago, but now she's much better and she is ready for discharge. So how are you feeling? Oh well, nurse, I'm little concerned. I'm excited, but I'm concerned as well. Okay, could you please tell me what is the reason and what is making you concerned? Oh well, nurse, it's just about how would I take care of my mother, this and this. Don't worry, we are here to explain you each and everything. So first of all, I would like to tell you about your mother needs. First of all, for the first 8 weeks, your mother needs NSAIDs or painkillers, which is very important. So for the first 8 weeks, that is approximately 2 months, you need to give your mother painkillers, that is non-steroidal anti-inflammatory drugs on time. We will let you know about those drugs. And second thing, you have to regularly change dressings and also help her in maintaining her personal hygiene. So are you understanding my point? Yes, nurse, I am understanding. Okay, that's great. Also, I would like to tell you that meal preparation is very important. So you need to help your mother, or you need to help your mother in the preparation of meals, or you need to prepare the meal for your mother. So would you be able to do that for your mother? Of course, nurse, I will do that. Okay, that's great. Then it's fine. Then there is nothing to worry. But nurse, I'm really concerned that how would I manage all these things, giving medication on time, maintaining the personal hygiene. I think I will make some mistake. See, I understand this concern is obviously genuine. I understand you are concerned about your mother, but trust me, it is perfectly manageable and it is not that difficult. Let me give you advice on the strategies which will make caring of your mother easy. So, should I explain you those strategies? Yes, nurse, of course. Okay, so first of all, you need to set up a routine for your mother. Second is to get the medicines organized. That means suppose if you have to give the morning medications, so keep these two tablets at a separate place. Then you can keep the afternoon tablets at separate place, and then you can give the medications accordingly. So this is known as medicine organizer, or you can organize the medicines whatever makes you comfortable. Also in medical line, there are Webster packs. Webster packs are the things which will help to manage the medications. So we will give you a demo of that. So do you want to take that demo? Yes, nurse, I want to. Oh, well, that's great. We will give you demo on the website pack. Third thing is that you need to ensure that she has everything nearby, because as you know that she will not be able to move that much. She just has undergone bunion surgery. So you need to understand that she would not be able to move. So there should be all the necessary things around her bed. And last, it is very important for your mother to wear a surgical boot. So please make surgical boot available to her, and it should be very nearby to her. So are you getting my point? Are you following me? Yes, nurse, I am. Okay, then also, but I'm concerned that why surgical boots? Like, why does she need it? Well, a role of the surgical boot is very important as it will protect the foot of your mother. So, as she has just undergone surgery, so obviously protection is very important to make this surgery successful. And now she is in the recovery phase. So, wearing the surgical boot will help to protect her foot. So, are you getting my point? All right. And the last important point, I would like to talk about the painkillers and the anti-inflammatories, that your mother has to take naproxen, that is the painkiller, or the anti-inflammatory drug that has to be taken 2 times a day, that is after every 12 hours. So it is just BD. We call it BD, means 2 times a day after every 12 hours. There is another drug that is ibuprofen, which should be given in the form of 2 tablets, and that should be given every 4 hourly. So there are 2 tablets that your mother has to take. But be cautious and make sure that you do not that the medications ibuprofen do not exceed more than 8 a day. That means you have to give after every 4 hours, and 2 tablets can be given, but still you cannot give it more than 8 a day. I hope you have understood everything. Yes, nurse, I have understood. Oh, that's great. Okay. Then I'm giving you this pamphlet. It contains all the instruction that we have just discussed. And I reassure you, there is nothing to worry. Also, there is a number on this pamphlet. That is our hospital number. You can call on that number. If you by chance need anything, just feel free to call us anytime. I hope it's all good. Okay, then take care of your mother. And I reassure you that your mother will be fine and it is not that difficult. And you have the pamphlet as well. If you find any difficulty, you have the number as well. So there is nothing to worry. All good? Okay, then take care of your mother and take care of yourself. Thank you. Never say see you soon. This can also be one of the problems of getting 340. In the end, you say see you soon or thank you very much. No, you just take care and thank you. Don't say thank you very much or thank you so much. This can be the reason of 340. Thank you very much. Thank you so much. Or not reassuring or saying see you soon. You don't see the patient soon. That is the main thing that you have understand in the medical field. So this is Dr. Bhupesh, and now I'm attaching that reading video as well as per our promise. And please subscribe our channel if you have not for the best OET sample videos. Thank you very much. And our contact number is 76967 34256 for the best OET coaching. Thank you.